with some questions. So we
Sure.
had a great. So we had a question about the response, the university's planned response when there is a COVID outbreak.
Great, so great question. The first thing I want to let our students know and our staff and faculty that are on the call today is that the university has been planning a response team approach since late March when we all went virtual and we still had a handful of folks that were on campus that needed to report for a variety of essential functions. And so our COVID-19 response team currently consists of about 20 individuals on campus. They range from our student nurses in our School of Nursing who are licensed and just finishing their degree programs, all the way up through administrators on campus here in our Student Health Center. We have 3 clinicians on our response team. We have 2 nurse practitioners and 1 nurse faculty from our School of Nursing that will be available to provide some responses and specifically some clinical perspective. And then we have partners with our environmental health and safety team on campus, as well as human resources to assist employees with exposure issues. And so how we are managing our response is we are asking our community members who have been to campus recently that if they are experiencing symptoms, generally feel unwell and suspect that it could be COVID, or they've been notified that they've recently been exposed or considered a close contact to someone who is symptomatic or was recently tested positive with COVID, to report that to our response team. And it's very easy to do. You go to the Cal State Fullerton main campus webpage and click on that COVID-19 orange toolbar at the top of that webpage, and it'll take you to our campus COVID-19 page that houses all kinds of safety information. And then there's an icon that says report an exposure or a positive COVID case. You fill out some very minimal information. It'll ask you, what general symptoms you're experiencing, when was the last time you were on campus and where were you, and whom on campus you had any close contact with for a period of like 15 minutes or longer. And then we will have one of our response team members get in contact with you, ask some more questions, and then determine, is it safe for you to be on campus or outside of your apartment? And then if not, when you can re-enter the campus community outside of your own apartment. And then we do provide some instructions on what self-isolation or self-quarantine looks like. For students, we can put you in direct contact with a clinician for a phone appointment to determine should you be tested or do you need additional medical care. And then we will also refer you to our Dean of Students office if you need support with connecting with a faculty member or another support program on campus. And then I do believe that housing has some protocol in place for helping any student who's under self-quarantine or self-isolation get food or potentially other necessary supplies that they may need, or can connect with the resident on whether or not staying in their apartment is safe and where else in housing they can go for the remainder of their self-isolation period. But I want to let all of our students know that no one who has either had symptoms for COVID-19 or is currently sick or has been exposed to COVID-19 will be made to leave campus. You live here, that housing has a plan for providing you space that will be safe for you to kind of ride out your self-isolation and self-quarantine period. And we can facilitate that for you here on campus. And so I just wanted to make sure that folks knew we're not booting you off campus if you begin to feel unwell, but we can provide support to you during that time.
Mary, could you comment on why we ask students and residents to report if they've been exposed?
Thank you for that, Tracy. We don't often ask our students to share a lot of real personal health information. We certainly understand that Health information is very private. But in this particular case, because we're dealing with an infectious disease that has been linked to serious health issues and even death, even among the college population, it's important for us to follow our state guidelines to make sure that we adequately clean spaces that someone may have been in if they were unknowingly going to be sick, as well as notify others who may have been exposed to that individual so that they can stay home and self-monitor for symptoms. Please know that the COVID-19 infectious disease response team will not share anyone's identity outside of our response team so that we can protect personal health information, but still let others know that they may be at risk. So for example, we would never tell a student who exposed them to COVID-19. We may just let them know that they visited a space on campus that may have had an exposure. And so we want to make sure that folks understand that we're asking for the information so that we can confirm and guarantee cleaning and sanitation, but we will protect your private health information from others.
If a resident finds out that they do have COVID, could someone talk a little bit about what happens here in housing in that situation?
I can talk about that. So as we mentioned, the university, we are asking that as you have symptoms or you're exposed to someone with symptoms that you go to the website that Dr. Becerra mentioned and complete information to share with the team that's reviewing those forms. Then if appropriate, they will contact our team about that someone needs to either quarantine or to self-isolate based on that information. And so then what that means, if you are asked to self-quarantine, what that means is then for the 14-day quarantine period, we would ask that you primarily remain in your residence with on your own or with a roommate if you have one. If you do have a roommate, if you engage with them during that 14 days, you would need to wear a mask even in your own residence. And then anytime that you're outside your residence, as you typically would, that you'd wear a mask if you're going to the health center for care, or if you're going to pick up your food from the gastronome, because if you're in quarantine, you still can access the gastronome to pick up food. Then at the end of the 14 days, then you'd return to regular activity. If you are asked to self-isolate, that's a little different. So then that means we would ask you and likely your roommate to move to one of our isolation spaces in the community. And so at that point, that would likely be, if you are asked to self-isolate, that will typically be for 10 days. You would then go to the designated space and remain there. And in self-isolation, at that point, you are really in that space for that time. As needed, housing will coordinate with Aramark to provide meals. So once a day, we will coordinate a drop-off of meals per your meal plan to ensure that you have meals during that time. But that will be done in a contactless way with our team, where we would notify you and we would drop the meals outside of the self-isolation space, and you can then pick it up. So there'd be no contact. The only contact with folks is right at the beginning. A member of our team may come to your space to drop off a key for you and your roommate to go to separate spaces. Then we will likely contract with a third party to clean your apartment. At the end of that time, if a roommate who was not showing symptoms, they likely could then return to the space they'd be told by Mary's team. And then the person in quarantine would wait for the entire period, again, get an okay from the health services team, and then would return back to their space. So again, we have the process in place that would keep you safe and our staff safe during this period. But do know, if you would prefer, you can always quarantine or self-isolate away from campus if that's your preference or you have that option. But as Dr. Becerra mentioned, we definitely can make that happen on campus if that's needed. The other recommendation we'd make, if you're in the quarantine space, we will provide disposable bedding. But beyond that, that was the reason we talked with you about bringing a go bag when you moved into housing last week. So ideally, you would have a bag prepared with all other essentials, toiletries, clothing, your books, some limited cooking items, anything you would need if you're isolated for the 10 days, that you would then take that with you to the space. We would provide some bedding, unless you'd like to bring your own. You can do that. So in an ideal world, that's why ideally you'd have that prepared. And if you have questions about that go bag, you can ask your roommate, or if not ask your roommate, ask your resident advisor, peer mentor, community coordinator, and we can help ensure that you have what you need to go to the space.
Thank you, Larry. You mentioned that there may be a situation where roommates may be asked to wear masks within their own apartments if someone has been exposed. Who do residents reach out to if their roommates aren't following the rules, either the rules of being quarantined or isolated, but just also the day-to-day rules of wearing masks on campus, not having overnight guests? What support is available to them?
Weston, would you want to cover that one?
Yeah, absolutely. I can take that one. So we sent out all of our new housing and residential engagement COVID policies to the residents last week, just as a reminder of what our expectations are during this time. Also, you all likely received the Presidential Directive number 21, which outlines more specifics when you're on campus related to our expectations with COVID-19. So if you're in a situation where your roommate may not be complying with these expectations, or you have information to believe that that's not happening, you're welcome to loop in your resident advisor and or your community coordinator. And what will happen then is we'll take some information from you just so we can get a better idea of what's happening, maybe some specific dates, specific instances where you're saying that they may have violated our expectations or our policies. And then at that point, that information will come from the community coordinator. So the community coordinator will reach out to your roommate in that situation or the student who's alleged to be violating our expectations and policies, and we'll have an educational conversation. Our first priority is to educate our residents and help them understand why we have these expectations, that we're not trying to enforce these policies because we want to or because we want to be extra strict, that there's reasons behind why we're doing this. So that will be our priority in these first meetings. There may be some educational outcomes that are assigned as well if a student is found responsible for violating those policies. Our first option is never to essentially kick someone out of housing or force them to move. That is never our first option. If it's a particularly egregious situation, that may be on the table, right? And we'll evaluate that on a case-by-case basis, but that is absolutely not our first option or our first go-to. So I'll coordinate with the community coordinators, talk through what an appropriate response will be. Likely it will be an educational meeting. There may be some educational outcomes that are assigned in hopes that the behavior ceases and that they choose to make different decisions in the future.
Thank you. Dr. Vigil, most of campus is closed. What services remain open for students? And how do they access things that they would need to complete their education, such as printing services, a place to study?
Yeah. So one thing that President Virgie likes to say is that our campus is open. So we are not closed, we are still open because we have a number of virtual services that are still going on. So all of our services, all of our programs, all of our events, they may look different, but they're still happening virtually. So I would encourage students, if they have any questions about student services that are virtual, to go to the Student Affairs website, fullerton.edu/SA, and click on the virtual engagement resources, and you'll get a list of all of the different student affairs departments that are providing virtual resources. Another outlet could be ASI, so our Associated Students Incorporated. They are still moving forward with programming and with events. And so I would encourage students to go to that website also, asi.fullerton.edu, for virtual resources. If there are any other food options and you're getting tired of the gastronome and you want to explore, there are some food options that are still open. So Carl's Jr. and Pollock's Library Starbucks are open for business. And so I would encourage you to look up their hours, fullerton.edu/food, for those hours. I will say that the library will be open, but it's on a limited space. So we're keeping a section of the library open for students to study, and students have to make a reservation to go study in the library. Their reservation will be up to 2 hours. And so the library will be open Monday through Friday from 8 a.m. to 4 p.m. So that's really there for students to study. We also have some students that maybe have a virtual class, and then they have in-person class right after or vice versa. So they need to rush somewhere to go study really fast. And so if you know that that's happening and you rather not do that in your room and you rather do that somewhere else, then go ahead and fill out that reservation form on the library website to reserve a space in the library. And the library's website is just library.fullerton.edu. And then you can just click on the top and there's virtual resources there. So one thing that students have been asking is printing services, and I think you mentioned that also. So we do have a service called Digital Print Services, and that resource is going to be open for students. And so I verified that with information technology, that will be open for students. So if students need to print papers or print out notes, I know when I was in college, I needed to print out my notes. I could not just look at a screen or things like that. I needed to have a physical copy so I could walk and look at it. So you could just email DPS for Digital Print Services at fullerton.edu and ask and inquire about rates. You can also visit their website for more information. So there are still things going on campus. We have the library open. And so there are things to help you to make certain that you are still successful academically. We are also having device requests. So if you feel that you need a laptop or need any sort of device to make certain that your academic experience still moves forward in a positive light, you can fill out a form on the Dean of Students website. And it's right on our homepage and it says device request, and you click on that and you could fill out a form for a device request. And I'll hand that over to Weston because he's been taking the lead on device requests to talk a little bit about what that entails.
Yeah, absolutely. So the current devices that are available are PC laptops, really nice little portable laptops. I have one myself. I really like it. It goes with me everywhere. So there's a PC laptop. There's also Wi-Fi. So right now we're having a lot of students, and rightfully so, experiencing Wi-Fi issues, right? They may be in a home where there's multiple people trying to access the Wi-Fi at the same time. They may be in a situation where financially Wi-Fi is just not an option in the monthly budget. Totally understandable. And so IT has these little MiFi devices that they've contracted out through, I think it's AT&T and Verizon, if I remember right, that will give you access to so much Wi-Fi per month. Again, as a disclaimer, these aren't meant to stream Netflix and Hulu and all of those things. No Real Housewives on the MiFi devices. They're only meant for your academics. So those static websites, I'm learning all these technical words from IT, these static websites that you may access for research, for those academic papers you may be working on, any other academic related thing you may need, those MiFis are great. They also will shortly, they don't have them currently, but we'll hopefully be getting in a shipment of webcams if that's something that you need. You may not necessarily need a whole new laptop, but you may just need a webcam. They have headsets, right? We're all working in different environments where there may be people coming in and going and all those pieces. So they have headsets you can use as well. And so really those devices are for you. You just fill out that form. IT will respond within, they're really quick, honestly, 2 to 3 business days. Sometimes it's shorter. They'll respond and approve that device and give you instructions on how to pick up that device. The device pickup process is completely contactless. So once you get that information, it will explain what you need to do to be able to pick up that device, and then you can keep that device for the semester. IT will send information out at the end of the semester how you go about returning that device, but there's no need to worry about, can I keep it through midterms? Can I keep it through finals? The answer is yes. You can have that device through the end of the semester.
Thank you. Dr. Becerra, will COVID testing be offered at the Student Health Center? And if not, where can students go for testing?
Thank you for that question. We've been getting that question a lot. Understandably, people want to know where they can go. So the Student Health Center is not offering COVID testing, and we don't anticipate offering COVID testing at all in the fall semester. There are a variety of reasons for that. One of the reasons is because in Orange County, there are adequate numbers of testing resources available. And if we offered testing, then we would have to purchase more PPE, that's personal protective equipment, that we take away from hospitals and other places. And so we are referring students, if you have your own private health insurance, COVID testing is free nationally. And so if you contact your primary care provider and you discuss any possible symptoms or exposure that you may have had, they should be able to refer you for a current infection test. Those tests do require doctor's orders, and so it's difficult to go and find one without having spoken to a medical provider first. So I would refer students first to their primary care provider if they have private health insurance. If a student does not have private health insurance, the County of Orange Healthcare Agency, and since you all reside on campus, you're all now residents of Orange County, can go to one of our county testing sites and get tested for free. And the closest one to campus is actually the Anaheim Convention Center. It is by appointment, so you do need to log on to the county website at ochealthinfo.com, and I'll put that in the chat in just a minute, and click on COVID-19 testing, and it gives you all kinds of options in Orange County where you can get tested. But it's important for students to remember that that testing should be free, because there's a federal requirement that COVID-19 infection testing is free. I also want to caution students against using testing that they can get in the mail or testing that is not infection testing. There's very little reliability on mail-based COVID-19 tests, and they will charge you for those, which tells you that that's not FDA approved. So be really careful to get tested through an identified testing site that's on the County of Orange Healthcare Agency webpage, so you know you're getting a reliable test and that you're really not getting ripped off. So we'll go ahead and put that link on the website in just a second, and then you can reference that. You can also look up where to get tested on the Cal State Fullerton COVID-19 website. It does have in the FAQ section a list, and the same link I'm going to put here will be on that website on where you can get tested in Orange County.
Just a reminder for anyone in the audience, if any of the pre-submitted questions isn't your question, please go ahead and put it in the chat box, and we'll be happy to have our panel answer that question for you. The next question I have, what if COVID impacts my income or my family's income and I can no longer pay for school or housing?
I can speak to housing. So if there at any point, if a resident decides they no longer have a need to live on campus, because that was one of the prerequisites this semester for folks being prioritized to receive a placement, was that there was some kind of need in order for a student to be able to achieve their academic goals this term. So if that need changes and there's no longer a need to live on campus, you can go to the housing website, and there's a link for submitting a license cancellation request. And then our team reviews those weekly, and we'll determine if we're able to approve the cancellation request. And then we would follow up, if approved, with the procedures for checking out and prorating fees and those kinds of things. But we will be considering those this semester, as we know that circumstances are definitely variable. And so we want to review and accommodate those as we can.
And if I could just add, if any student's income changes, I would encourage them to reach out to financial aid and let them know about the income changes for themselves or their family. There may be additional aid that's available to them. There also may be additional loans that they can take out for them to continue with their education. So please, if your income does change at all, reach out to financial aid to try to let them know that, hey, income changed, I may need some more money, and then they'll work with you to find something out. Also, if the income has changed drastically and you become, housing or food insecure, the Dean of Students Office does also oversee Tuffy's Basic Needs Services Center. So I would definitely encourage you to reach out to Tuffy's Basic Needs Services Center to fill out one of our information sheets, and I think it's a referral sheet online. And then once you complete that sheet, then we will then reach out to you. Someone from the team will reach out to you and chat with you and figure out, what can we provide? If it's housing insecure, maybe we can provide something there. If it's food insecurity, there's some resources there. We also have the Titan Emergency Fund. That could be something else that we could explore. So, if your income does change drastically and, you do have to reach out to us, please reach out. Please utilize us. There's a lot of resources on campus. And if you just don't know where to go and you hit a roadblock, reach out to the Dean of Students Office and we'll direct you to the appropriate resource.
Thank you. Is it okay to be outside? What guidelines exist for being outside on campus, outside in housing?
start that one, and then I know some of my colleagues might want to add in a little bit. We actually, if you are already living on campus or you're taking a class on campus, it's actually very safe to be outside. And it's a good idea to get outside and get a little exercise and get some fresh air, even in the heat. We just ask that you maintain that physical distancing of 6 feet or more between you and other people, and that you do need to wear a face covering when you are on campus. That is a statewide mandate. And since we're a statewide facility, we do require that face covering. If you are exercising outside, say you're going for a jog around campus, or you're walking briskly around campus, you don't have to keep your face covering on if you are exercising, but just have it with you. And then when you do come in contact with others, that you put it on momentarily and then can remove it after you have separated for people that you may come in contact with. So yes, you definitely want to get outside and enjoy the fresh air, enjoy Southern California weather, and get a little bit of exercise and get a little bit of break from Zoom fatigue.
And I know in housing, the question has come up about that because we've covered many of the outdoor seating areas, but that is because we've covered those that are really designed for congregating. Because of some guidance from the county, we need to protect folks from being outside in groups where folks might not be able to practice social distancing as easily. But we have the seating that's available individually, like our benches. Those have remained, and I believe even today we've put up some decals letting folks know that you can sit really one person per bench. That's what it can accommodate with 6 feet of social distancing. So we were able to leave those out and available for folks. So those are there for you. I encourage you, if you do use the outdoor seating, that you do, especially if you're there at night or on the weekend, that you disinfect the space on your own, as that may not have happened at nights or on the weekends, but it is there for your use as you're outside.
And if I could add also, if you're looking for guidance, I know Dr. Becerra had mentioned, we want you to go outside when you're on campus. Please look up President's Directive number 21. It has more guidance for our students and our employees on campus when it comes to wearing face coverings and following signage and also physical distancing. So it's pretty much outlined in that President's Directive if you have additional questions about what I can and cannot do while on campus.
Thank you all. The next question we have is surrounding academics. If you have COVID and are unable to attend classes, will the professor work with you to complete the assignments or to make up tests or quizzes that you may miss?
I'm going to hand that over to Weston because I know Weston's involved with the response team.
Yeah, absolutely. So if you encounter a situation where you are experiencing COVID and are unable to complete coursework, attend class, whatever that might look like due to your illness, and your professors aren't being understanding, you do not have to disclose to your professors that you are COVID positive or that you're being tested for COVID, any of those pieces. Professors have been given guidance that they should be especially understanding during these times if students reach out and request accommodations. If for whatever reason you reach out to a professor to request accommodation and there seems to be some resistance or inability to provide that accommodation, you can reach out to the Dean of Students office. And the easiest way to do that is emailing us, which is deanofstudents@fullerton.edu, and we can help advocate on your behalf. Obviously, we can't make promises that we can help move exams or that you don't have to take exams or you're exempt from certain assignments, but we can help advocate for you with your professor to find some solution that works for both you and for the professor. So again, the first step is you reaching out to your professor to ask for that accommodation or some sort of flexibility. Again, you don't need to disclose anything to the professor. They've all been instructed to be a little bit more understanding and accommodating during these times. If for whatever reason you're experiencing some barriers or roadblocks and need some additional support, email the Dean of Students office and we can work with you and help advocate for you.
Last semester, students had the option to take credit or no credit for their classes. Will that be an option this semester?
That was great, wasn't it? But no, unfortunately, it will not be an option. So no, we're going back to the regular structure. And the reason why we had credit, no credit is because of the transition, right? So we were in the middle of the semester. COVID happened in March. We were transitioning from in-person to virtual. And so we wanted to allow that flexibility. But unfortunately, no, for this semester, we're back to where we were before with our grades.
Thank you. How safe are students in classrooms? Are the classrooms sanitized after every class?
So our environmental health and safety team has worked diligently over the last couple of months to upgrade our air filtration system on campus. There were lots of recommendations made by OSHA, which is an occupational safety and health organization, as well as the Centers for Disease Control and Prevention, to make sure that we had the best air filtration and filters that can withstand transmission of infectious diseases such as COVID-19. So all of our air filtration systems, as of the end of this month, will have been completely changed and upgraded. And the every classroom and space that will be open to students on campus will have the required filtration and air circulation and ventilation that is required under these more strict guidelines. So, but we do also want to make sure that students understand that that doesn't negate their responsibility to wear a face covering indoors. So even if you are 6 feet or more from someone in a classroom or a lab or the library, you still need to have that face covering on the entire time, and remove it only if you are intermittently eating or drinking. And we do ask folks that if they're going to be eating or drinking for a longer period of time, that you do that outside, because we want to make sure that as many people as possible are wearing those face coverings to safeguard around them. The second part of that question is, are classrooms cleaned or sanitized between classes? What we can tell you is that all classes, all classrooms and instructional areas in the library are cleaned either every night or every morning. So they're cleaned at least once a day. And for classrooms, our scheduling department has worked really hard to make sure that classrooms are not scheduled back to back, meaning less than 15 minutes between the classrooms or between the class periods, so that cleaning can be done in between classes. For those rare occasions where that can't happen, cleaning materials will be available inside the classrooms, and faculty and students have been asked in those spaces to please clean off the desks as they walk in. So one recommendation might be to you that anytime you enter a classroom or space that has cleaning agents available, it's not a bad idea to just take those and be proactive and wipe that space down that you will be using, so that you can be ensured that that area has been cleaned.
And there's also a great video on the Fullerton website, fullerton.edu. It's called Getting Ready for the Fall Semester. And it shows exactly everything that Dr. Becerra outlined. It shows our facility managers disinfecting. It shows them sanitizing. It shows the signage that's around campus for you. So, you know, if you have a couple of moments, go to the fullerton.edu webpage, and it's called Getting Ready for the Fall Semester. And it's a great video that outlines all of that.
Earlier, we talked about what residents can do if their roommates aren't wearing masks. They have the support of the Housing and Residential Engagement team. But what do they do if they're on campus and they notice that someone is not wearing a mask?
Well, enforcement is a priority for us also. With President's Directive number 21, we want to make certain that we're enforcing that. So if they identify a staff member or an employee who is not wearing a face covering, they could contact Human Resources, HRDI, and Labor and Employee Relations, and then they will go ahead and take the report and handle it on their side. But we do have an enforcement process when it comes to our students. And I know Weston works in student conduct. So again, I'm gonna hand it over to Weston to talk a little bit about that enforcement process when it comes to students.
Absolutely. So I think there's going to be a variety of situations that may come up with this, right? You may know the person, you may not know the person. So we'll approach it from a few different lenses. If you don't know the person, it's critical, as we've already mentioned, that you're still following our expectations and policy. So you have that face covering on, that you're maintaining that at least that 6-foot distance, and that you're kindly asking that person, let's say if they're not wearing a face covering, right? Hey, would you mind putting your face covering on? Hopefully they'll listen and say, yep, absolutely, I just forgot it or I didn't realize, and then they'll put that face covering on. There may be some resistance, we don't know, right? If that's the case, again, don't engage. You can remind them and ask and then step away. You're welcome to submit a report to the Student Conduct Office. It's helpful if you know who the person is so we can do follow-up. If you don't, we'll still take the report. So don't hesitate or feel like you can't submit a report just because you don't know. When we do receive reports though, and if we do have students that are named and we're able to identify those students, what we'll do is we send a letter to students asking them to come and meet with us. And in those meetings, again, our primary focus is education and restoration. So we want to know what happened. That's really the student's opportunity to respond and give us their perspective on the situation. We engage in a conversation around what our expectations are, how their behavior may or may not be in alignment with those expectations, and then how we can restore potential harm that they've caused as a result of that situation. So if a student's found responsible for violating our COVID policies, there's a range of educational outcomes that could be assigned. If they're found not responsible, we're still going to take that opportunity to educate and remind them that one, they should be following expectations, and two, that if a community member is asking them to do something that's reasonable and in alignment with our policies and expectations, they should follow that, right? Peer accountability is critical, and we can't do this if we're not holding our peers accountable and allowing our peers to hold us accountable as well. So those are the conversations that we'll have in the Office of Student Conduct. Again, focus on education and restoration. I mentioned earlier, for those specific acts that may be particularly egregious, we will follow our conduct process. And unfortunately, one of our outcomes can be suspension or expulsion. That will never be a first come outcome. I can tell you that, unless it's particularly egregious. We want to make sure that we're focused on education. We want to make sure that we're restoring any harm. There may be situations that warrants, and even in those situations, we're still going to try and provide some education and restoration.
And just to know also, there will be some students that will get, students and employees that will have exceptions to it. So they may have a disability, or there may be a medical reason why they cannot wear a face covering. So those individuals will work with either our health services department or our disability support services to get that exemption. And faculty will be notified of that if they are in the classroom. So just know that there may be some individuals that do have that exemption for medical or disability reasons.
Thank you both. I received a question in the chat. Orange County is seeing a reduction in the number of infection rates. Is there a number where classes at Cal State Fullerton will resume to normal in the fall? As we are seeing, K through 12 will be resuming if they have a certain lower percentage of daily infection or positive tests from the governor's office.
So I'm looking at Dr. Vigil because I wasn't sure if he wanted to take this one. What I can tell you is that our chancellor's office, so Cal State Fullerton is one of 23 campuses across the state of California. And our chancellor's office has required all campuses for the entire fall 2020 semester to be mostly virtual with very limited on-campus instruction. And so even if the numbers fluctuate in Orange County, which is a great sign that our infection rates are decreasing, we are going to stay mostly virtual, and the schedule will remain set for the fall semester. I know that there are discussions on campus about what spring 2021 will look like. And again, we are waiting for our chancellors. We always have to defer to our chancellor's office first about what their recommendations are, what the state recommendations are. And then the last one is what our Orange County Public Healthcare Agency's recommendations are. But for fall 2020, we are staying in the mostly virtual environment.
And as Dr. Becerra mentioned, we had a group put together in March that had been working on the transition, and that group has consistently continued to meet. So we actually meet every other day, if you can believe it. So Dr. Becerra and I see each other every other day, practically every day out of the week, because we're always meeting, we're always planning, we're always thinking about this. And so just know that we are thinking about winter session already. We are thinking about spring semester. And we're planning as though things will stay the way that they are, but things may change. And if that changes, then just know that we'll have a plan for that also. So know that things are being discussed and worked on.
Thank you. That's all the questions that I've received, and we're almost to the end of our time together. So I just wanted to give the members of our panel time for any closing remarks that you may have. And I want to thank you for your time. I definitely learned a lot, so I do hope that the people who participated today and who will watch this later will also learn a lot of information. So thank you.
I'll start with the closing comments. I just want to let everyone know that our campus really has put a lot of effort and thought into how we can make this fall 2020 the most meaningful and safe for everyone. And it's going to take the personal responsibility of every member of our community to be able to continue with our safety protocol. So we do ask those of you, even though we don't always understand why, or we wish it were different than it is today, because we all wish this was different, that we stay committed to our safety protocols so that we can open up as soon as possible, and that no student or employee on our campus has to suffer unnecessarily. If you have any questions or you in any way have concerns around COVID-19, please don't reach out to contact the Student Health Services. We are open Monday through Friday from 9 to 5. And we will be available first with a telephone appointment and can follow up with in-person if necessary. And that information is on our student wellness website, which I'll put in the chat right now.
Thank you, Dr. Becerra.
I would just thank you all for attending. I hope you continue to attend our Wellness Wednesday programming. Thanks to our team for coordinating the town hall, and please continue to provide us feedback. This is an ongoing journey. This, it's a learning process for all of us. So please continue to share with your resident advisors, peer mentors, community coordinators, folks that you connect with in the housing community as you have feedback, questions, comments, concerns, because we also, again, want to make this the best experience. And we appreciate you choosing to stay with us this semester, and we want it to be the best experience possible. With that, one reminder around food service. We know the gastronome is only open Monday through Friday this semester, so make sure you access that as you can. And then the community market will be open on Saturdays and Sundays, so stop by there if you have if you need a snack or something on the weekend when the gastronome is closed. But thank you again for your time today.
Thank you, Dr. Martin.
I just want to thank everyone also. I know that we talked a lot about health, but I also want to acknowledge the fact that there's a lot of mental health resources that we have available on our campus. And having to experience COVID and being inside, and it's just it takes a toll on us. And so I want to make certain that you all understand that we do have our counseling and psychological services. They are still meeting with students via Zoom, so that is still happening. There's also a great resource called U at Fullerton, which is u.fullerton.edu, which is an online platform portal that talks about student wellness resources. It actually has a lot of resources about COVID and coping through this pandemic. So I really want to highlight the mental health also. And I know Dr. Oseguera, who's our Vice President for Student Affairs, was not able to join us today, but I know that she would encourage me to continue to be involved, continue to take part in those virtual resources, visit the Student Affairs page, see what we have to offer, because all of our programs are still moving forward. Diversity initiatives and resource centers are still having their programs. Dean of Students Office with our Toughies Basic Needs, we're still having our programs. Everyone is still moving forward. So please, please, please continue to take part. We are still open. We are still doing the things that you loved when we were doing it in person. Now we're just figuring out how to do it via Zoom or virtually somehow. So please take part, and thank you.
Thank you, Dr. Vigil.
Yeah, I was just going to retweet to what Vincent said, right? We're still here for you, even though we may be at our homes and not on campus with you. Your resident advisors and peer mentors are phenomenal. We just spent 3.5 weeks with them. They are more than prepared and more than adequate to help you all with whatever you may be experiencing this year. So please rely on them. If you need higher level support, your community coordinators are there. Jennifer, Becca, Izzy, they're all phenomenal as well. So please reach out to them. We are available for you. We're here for you. And again, as Mary said, it comes down to personal accountability, right? We can't do this without you, regardless of how many plans we have as a university or how much work we've put in. If we can't rely on you to do to help us, then we can't rely on anything. So we really, really need you. We trust you. We know you're the best of the best because you go to Cal State Fullerton. And so we really need you to help us through this. And hopefully when we're able to get back on campus, we can resume all these in-person events and activities that we love. And until then, stay safe, stay healthy, and please let us know if there's anything we can do to help or support. We're here for you.
Thank you, Wesley.
One thing I would encourage you all as well, if you do have something that comes up and affects your classroom performance directly, one of the things I really want to emphasize, besides the resources with the Dean of Students, which are fantastic, I'm so glad that that's there, don't hesitate to talk to your faculty, talk to your professors. That's what office hours are for. We have office hours for you. That's time dedicated for you. And we're here to help as well. We understand that all of this is going on, is different, it's new, but we are here to be a resource. We have been, having these conversations amongst ourselves with other faculty about how we can be more empathetic and making sure that we stay open and flexible when it comes to making sure your needs are met, especially at this time. If those of you who do live here, I live here with you. If you have trouble, feeling okay talking with your professors, come talk to me. Send me an email. We can chat about that. I can help you strategize on how best to approach them, and we can figure out how to work together to make sure you have your needs met as far as the classroom is concerned and your academic performance. Right.
Thank you, Dr. Traylor. With that concludes the program for today. Thank you all for attending. Thank you to our panel for all of the great information. And stay tuned to our social media, your email, and postings from your RAs and PMs with more information about future Wellness Wednesday workshops. Thank you all. Enjoy the rest of your Wednesday.